I mean, you've been calling for mass testing since late March. It's now late August. Why are your calls seeming to fall on deaf ears, do you think?
Well, I hope they're not. And actually, this morning, Matt Hancock, the Health Secretary, was saying that the government does now want to move in the direction of mass testing, and that's to be welcomed. But it's also urgent. I mean, it's because there are really two things, I think, that lie behind the desire for mass testing. Number one, the majority of people who get COVID-19 are asymptomatic. So, in other words, they suffer mild or no symptoms. And therefore, if you're only testing the people with symptoms, you're not capturing a large number of people who, despite being asymptomatic, can nonetheless spread the disease. So that's the first point. And the second point is that it's one thing for the government to permit people to do certain activities. But the question is, how do you build the confidence in the public that they actually do those things? So you can say to people, go back into work, but if they don't feel safe, then they're going to be reluctant. And if you want to reopen schools, universities, workplaces, if you want international travel to function again, the only way I think you can do that is by doing testing at scale. And that's why we've got to move to this. And you know what we've tried to set out in the paper, which I signed actually, not just myself, but with William Hague, who's my old Conservative opponent, and Jeremy Hunt, is just to say, look, this is not a political play. It's just when you look, and by the way, when you track what's happening around the rest of the world, this is where people are moving. They're realizing that it's hard to get the economy functioning again as it should.
But you say that mass testing needs to be set up now or in the month of September to avoid a potential second wave that could hit the UK in autumn. I mean, we are running out of time, aren't we, if that is the case?
Yeah, we are running out of time, and that's why it's very urgent. Now, to be fair to the government, it's not that they've been doing nothing. I mean, we've got the capacity now to test about 340,000 people a day, but actually we're only using around about 170,000 of that capacity. So we're only using about half the testing capacity we have now. So one of the things we suggest is, as you build up to mass testing using all the available lab facilities and these new rapid on-the-spot tests, that we also engage in using the testing capacity we've already got in order to test more groups of people. So, for example, when universities come back, you know, the sensible thing is to test the students as they come back and do it at halls of residence. You know, there's a lot of innovation happening in the testing space today. We set out a whole range of the new tests that are available. Some are available in this country. Some are being developed in the United States. I came across two just yesterday that have been cleared now by the authorities in the US. These are rapid on-the-spot tests that will give you the results literally in hours or sometimes even in a few minutes. If you're able to do that, if, for example, you were able to test people as they come into the country before they then leave the country, of course it would give you a much, much better way of avoiding the strictness of the lockdown and the quarantine rules that are going to do such damage to business.
How concerned are you about a second wave hitting this country? And if that happens, what will the consequences be?
Sorry, I didn't hear that last bit, Emma.
Yeah, no problem. We must have had a glitch on the line. Let me try again. You talk about a second wave. How concerned are you of the possibility of that happening? And what would the economic consequences be to the country if that is the case?
Yeah, so the problem is that we're not going to be able to eradicate this disease. For one thing, it's circulating globally. So you're going to have to live with it. Now, the risk is, as you get into the autumn and the winter, and the weather gets colder, the days get shorter, the nights get longer, if you were to have a resurgence of the disease, you know, maybe you won't, but if you were to, I think it's very hard to see how you go back into lockdown. Or at least without really catastrophic economic damage. I mean, already the damage from this is pretty terrifying in my view. And if you can't, therefore, by the time you get to when that resurgence may happen, if you haven't got the right containment infrastructure in place at that moment, then your risk is, yes, you end up with a second wave, and then you're faced with some absolutely impossible choices between locking down with all the damage that does and keeping open with the possibility of the disease spreading even further.